It is any addition, it's and a try addition. So now, one know how I obey so a fossil now what timid a boa and answer would be a on also a friendly insane, and answer a friend of a friendly incense. So a ye and children so bit me up while sending a bear also no, and near my bit me a quay at the amount. A hand a inside wealth mind, ye church for psychology, mental health, any neurology. A TV episode share for a training and this is the best channel for you to follow. And to try follow us and also share our videos so that a lot of people can also learn from what we are teaching. Today our topic is the neurodevelopmental condition. Because in neurodevelopmental conditions na onse na yɛbɛwo mmɔfra bi no na sɛbe asɛ mmɔfra no obi wɔ hɔ no ɔbɛka sɛ abɔfra no n'adwene mu ɛka no kakra anaa nso sɛ abɔfra bi wɔ hɔ no ma ɔda hɔ saa wɔntumi nsɔre ɛna abɔfra bi nso wɔ hɔ no nkoranko na sɛ obɛtumi asɔre a ne kasa no nhyɛ da ɛnyɛ yie. You could see that you have certain abnormalities are and this is what we are going to talk about. Most of the people call this condition as punishment to parents. If you are not born be or and no and this sense as no abaniso and answer papa bonny be or and another sense as will be abaniso. But now we want to educate ourselves publicly on these conditions so that people will know that it is not obiponia okoye yeno and no enamasa condition we ede abaniso and answer aba nebaniso. But these are brain conditions which children no face through birth. A brown must share ye flumo crampo mayano. Some of the children experience this condition before say they will come outside, and when they come outside or when they are being born, and also know the condition continue to worsen. This condition starts early in the womb, because we know that the brain starts working in the womb. Adwene no ɛhyɛseɛ ɛyɛ adwuma ɛbra nipa woda wo maame yam anaasɛ bra abofra ɛda ne maame yam. So the lifelong humanity story no begins from the womb, not outside the womb. So most of these conditions no we want parents and especially the mothers no to know say some condition we know. So wofa yɛfuna wobɛtumi ahwɛ wo ho so yie sɛnea ɛbɛtumi aboa abofra no na ɛnkɔfa conditions we be mfambrɛ no. We know that there are two cells which forms the brain. Early childhood we have two cells which forms the brain, which is the neural plate, and this neural plate forms the neural tube, which in other words, we call them the central nervous system. Because the central nervous system, we know abeye in nipeduano aquabia, and when you crane nipeduano ye, bako any the brain, which holds the mind, and about consonant was spinal cord. It when these two cells form the neural plate, which leads to the neural tube forming the brain and also the spinal cord na na forme sa nima sometimes ehyia ɔhaw kakra ɛwɔ yɛfun nim anaa nso sɛ nneɛma bi wɔ hɔ nom a free outside the womb and also affect mmɔfra no ɛno na me pɛ sɛ me na ɔbɔ so sɛ ne ɛbɛyɛ a wafa yɛfun a wobɛhu how you can handle yourself. The first one no, although we have genetic side, and this genetic side helps the brain wiring. It helps brain wiring. Into one say at times no, say oh baby na say wo therapy hormone na say wo pediatric nurse and I say even a psychiatric grandpa. We ask questions. If you questions ne be say what we say ebi wo wabusuyum and I say ebi any wabusuyum. Yeah, the reason why we ask this question is the genetic part, your DNA forms a lot in this formation of the brain because it holds the structures, it holds the code for forming this brain and also forming everything around you. The first factor is the genetic factor. A as a condition bi wɔ abusua bi mu a at times no the risk of getting it is higher than say ebia enipa no enya. It depends say partner A will be na partner B enibia. We have a ratio for calculating either the possibility of having such children. Now if partner A will condition B, partner B will condition B, not the risk of getting this condition very high. The next one I'll talk about is mother's emotion. Mother's emotion also helps in formation of the brain. We are talking of the first trimester of pregnancy. Ebra abofra so at the 18th day at the air corner. And nneɛma wei ɛtae ɛha dwenti yɛbɛsrɛ sɛ mother's mood sɛ maame bi wɔ hɔnom na so ɔfa yɛ fo a wobɛhu sɛ ɛyɛ ana ɔnam atetee ɔnam ɔhaw mu atetee no bitumi from the family side, both the male and the female family side. Ebi nso wɔ hɔnom nso so a ebia ɛfiri the immediate family, which is the husband side, and as the other related immediate families no woman. At times a juma crown put me the stress and then your man so at the total parents and so one name or beko juma or bebre or befoka then or 4 year no all this stress in the panel and bread sarpe you could say it add a lot of stress also to this fata in the womb. Iti abofra no so share your from na ono enim hwe no the mother's emotion say bia maame ni soon udi abrɛhoɔ stress ɛkɔ so sɛ nneɛma wei ne nyinaa nso no it also adds stress to the child in the womb. Ɛno nti no yɛbɛsrɛ sɛ mpo no maame no ɔwɔ hɔ nom na sɛ ɔwerɛhoɔ a yɛbɛsrɛ awerɛhoɔ no deɛ wɔ hɔ you cannot go without it, and a lot of people are also passing through emotional traumas and other things, but we pray sɛ obiara bɛtumi ɛde ne ho so kakra na etimi aboa sɛnea ɛbɛyɛ a abofra no ɔhyɛ yɛ fom no will not have these complications. Conditions need to be any genetic, but because of how the parents pass through stress or also the parents' emotional regulation, how it works. It is a brain no forming with the first 18 days now. The brain and the spinal cord now. From the 4th to the 8th week, so another part of the brain and so forming. And this part of the brain we have the forebrain. The forebrain nejuma also say a na emotions, learning, any memory no that is the forebrain. It's from the 4th to the 8th week, when we say it is a stress never forebrain forming baby abofra de sua de baby a keeping memory no no won say na eno nso no ha no enti abofra no da ye phone mu nyina no automatically no na osua bibi ye phone because the forebrain is being formed from the 4th to the 8th week. Enti no ye besre na say oba nyama yetimi treat ne even so ko hospital grandpas ebi wo how the nurses or the doctors themselves crambo ebi treat abofra parents na at times ebi wo honoma inkoyi enti ye besre say yesua san nyama we should just know about these things and help parents and also mothers. From then we have the midbrain. The midbrain then so for me the midbrain nejuma and also say movement and sensory integration, and also need for movement and sensory integration. Abofra da your phone mode on to your phone so abon say abofra na keka ho ana say nti hono no na adwen na emasa keka ho no amba na abofra na so etimi ede keka ho. And the next one I'll talk about is the hindbrain. The hindbrain is for breathing, sleep, and also heart rate. The other moment, said the nakoma ebebo, and said the friend bed that way your phone, and also ever for me. Thank you for watching. Continue to be with us, and